Few of the things that have changed that we've really focused on is talking up the surveys that the patients will get from Press Ganey. We've done a number of things that we had never done in the past. One, we implemented iPads in the department, talked to the patient about the iPad, walk them over when we're done with their exam, have them take the 7-question survey on the iPad. One thing that we've also done is we've put signage on the doors in each room, letting the patients know that they will be receiving a survey. Talks about that our service is going to be very good, gives contact information to Debbie Crusoe's line in the event that there's something that's not very good. The other thing that we have done is we created flyers about the surveys, handed them out to the patient, which then kind of makes the tech or forces the tech in terms of talking about the survey and letting the patient know that they will receive a phone survey from Press Ganey. One of the other things that we've done in terms of the survey that we've hit on as a group is we want to explain to the patients about the test and treatment part of the survey. And the personal issues part of the survey, because that is the main focus of what we deal with here in radiology or in imaging about the survey. We've talked about the explanation and treatments of the test, talked about friendliness, privacy, safety, focus those words in using keywords like letting the patients know if there's anything that we can do for their comfort, for their privacy. Again, kind of just explaining to them about the survey, letting them know that they will receive the survey in the mail, but we do focus on the test and treatment portion, explaining, giving the patient the opportunity to ask questions, and just kind of hitting those key points of the survey that reflect on our department.
In our department, we have a variety of things that we've been doing over the past year that has, I think, improved the way that we treat our patients and the way that we believe our patients perceive us. And I think the most important thing about that entire aspect is that it forces us as technologists to look at life and look at our department through the patient's eyes. And so instead of just assuming that patients are coming for their radiographic exams, we can understand that they have choices. They can go to different hospitals, and so we're going to strive to do our best to make them not just comfortable and well cared for here, but want to come back to us to be cared for and have their images once again. So those things that we've had done in the past year that have helped us to reach that goal is to use an iPad survey tool that we have mounted in the hallway near our outpatient waiting rooms. And so we can get instant feedback from these patients. So we have an immediate indication as to how our care has been for them in that brief visit during that examination that they had. We've also improved our signage, both in the X-ray rooms themselves and also in the waiting areas of our department, so that the patients understand that we are serious in trying to strive for these very good ratings that we all want to see come back from our efforts. We also have a flyer, a single-page flyer that we give to our patients upon their departure that alerts them to a phone survey that they may receive in the next 1 or 2 weeks after their exam, so that they can give us even more feedback and more detail and personal comments to help us improve our future performance. We have a weekly meeting with Sue Murphy, the Vice President of Patient Experience, and Sue Murphy's been great in giving us lots of feedback and ideas, and she also listens to our ideas as well. And I think these meetings are very productive. We meet for about an hour a week, and we've been doing that for the past couple months or so. The data available to us hasn't been available to us before. This is the other thing that we've been happy to see over the past year, is that the data from everything that we've been doing is coming back to us either at the weekly meetings or offered to us via email. And so the employees themselves can see how they're doing on a week-to-week basis.
Well, there's a few things. One, being more involved in actually collecting the data and talking to staff about the data. I personally have eliminated some of the phrases that I've been using in the discussion with the patient, caught myself, and actually was pointed out by a few people that I was using the word hopefully, which kind of brings a negative vibe to the actual explanation or the talk with the patient. So I have cut that out of all the verbiage and now just kind of stuck with the main points and talk about everything being very good versus hopefully everything was very good. The other thing is just by being part of the team itself, the outpatient team, and collecting the data, I've been trying to be more of a vocal leader, discussing with the patient or discussing with the techs in the department, being a kind of vocal leader, letting them know that, hey, this is something that we have to be consistent with, making sure that people are consistent. If someone isn't consistent, kind of talking to them about it, and just letting everyone know that with consistency and with the hard work that we do, that if we continue to do this, it will improve our scores.
The things that I've done to change my approach to patients is to try to look at everything through their eyes instead of worrying about what I have to do technically and how I have to satisfy a time frame and a quality standard. Many times I find myself and others moving toward the technical side rather than the human side. And so when there's a patient there, we always have to remember that this is a human being and they don't really care about the technical side that we are responsible for. They care about having a good experience while they're here. So we make sure that they understand that we're striving for their very good rating, which is our highest rating in our surveys, and that they deserve to receive service that would trigger them to give us that very good rating. So that is the turnaround that we try to make, the mirror in the image, if you will, to try to make our patients understand that we do understand them as humans and they have human needs and human responses, and we make sure that their privacy is taken care of, their comfort is taken care of, and of course we give them the best image quality that we technically can produce. As the lead technologist of this department, I'm also part of the effort to train students as a clinical instructor. And so the students that we get through the affiliation at Triton College are part of our efforts to keep patients experiencing consistent care. And the students, therefore, through their clinical training, not only learn the technical aspects of the job, but also the aspects of the job that deal with the human side of the equation. So our students are included, as well as the technologists, in setting standards and setting performance levels that are expected of them as they learn the exams through the program. So the students, therefore, have just as much responsibility as they become proficient in each exam as the technologists do. So our efforts to train them is not just technical, it is also very human.
So now what we're going to do is take you through the patient experience from start to finish, carrying the patient from the dressing room through the exam room to the completion, having them use the iPad. I'm going to grab my patient now if you want to come along with me. Mrs. Hernandez. Hi, my name is Frank. I'm one of the X-ray technicians. I'll be the tech taking care of you today. I'm going to grab your paperwork and have you follow me right this way. So how are you today?
Fine, how are you?
Good, thank you. Come right in here. What I'm going to ask you to do for a second, just grab a seat, and we'll explain everything to you in just a second. Let me grab some stuff. Okay, Mrs. Hernandez, I want you to give me your full name and your date of birth to assure your safety.
Okay, Carmen Hernandez,
Okay, and your date of birth?
8384.
And why did the doctor want you to come in today? What kind of problems are you having?
Oh, I was having stomach pains
How long have you had the pain for?
for about 3 weeks.
We're going to take a couple quick pictures. This will only take a few minutes.
Okay.
If at any time during the exam you're uncomfortable or you have any questions, please stop me and feel free to ask.
Okay.
Okay, so I'm going to have you come this way. To make this more easier for you to get on the table, more comfortable, and for your safety, I'm going to have you use the step stool, climb up. You're going to lay flat on your back, your head on the pillow there, your feet will be this way. And for your privacy, I'm going to give you a sheet to cover you up.
Thank you.
Would you like a warm blanket?
Sure.
So again, what we're going to do is take 2 quick pictures here. This won't take long at all, just a few minutes and we'll be done.
Okay.
Again, if you have any questions or concerns at all, please feel free to stop me and ask me any questions. Okay. Are you comfortable the way you're laying? Would you like a pad or anything under your legs?
No, I'm fine. Thank you.
What I'm doing right now is just getting the cassette into the table here to get you lined up for the picture. Once I'm done with the 2 pictures, I have to develop them, check them. That takes about a minute or 2, and then I will be back to let you know whether we're finished or not. Now for this picture, I have to feel for your hip bone. If I press too hard at all or it's uncomfortable, please let me know. How's everything so far? You okay? Good. Alright, what I'm going to ask you to do now is hold your breath, don't breathe. Good, breathe. Take one more picture now and that'll be it, okay? How you doing? Everything very good?
Yes.
Any questions, any concerns at all?
No.
One last time here. One more time, take a big breath in and hold it, don't breathe. Good, breathe. Okay. Are you comfortable laying the way you're laying while I check the pictures, or are you more comfortable sitting up and getting on the chair? Okay. And I'll be right back, it'll just be a few minutes, okay? Mrs. Hernandez, we're all done with your pictures. The radiologist will review them. Typically, your doctor will get the results within 24 to 48 hours. I'm going to help you out. Was everything very good today?
Yes.
Cover you here so we don't trip and fall. I'll help you down from the steps. So then there's a few things I have to talk to you about before I let you go. I have some paperwork here for you. Again, my name is Frank. This is the number here to the X-ray department. If you have any questions or concerns, please give us a call. What this is stating is that your doctor will get the results typically within 24 hours. If you give them a call tomorrow, they should have the results. If for some reason they don't, have them call this number. We'll get it faxed from right away. This other form here, it is discussing a survey that the hospital has a company conduct. Pretty much what the survey is from is your experience from the time you walk through the main lobby doors through the experience here in radiology. The key questions for our department are about your test and treatment and about the personal issues. We ask if you can answer the survey questions. It helps us to continue to provide very good care to all of our patients. Okay? The other thing I want to do is when we walk back to the dressing room, right outside the dressing room door, we have an iPad. What our department is doing to continue to provide very good care to make sure that we continue to provide very good care to our patients, we're asking patients to take a quick 7-question survey right before they leave, verifying that everything is very good. Okay? So we'll have you follow me right this. This is the iPad here. I'm going to select myself as the person who took care of you today. And again, there are 4 questions on the first sheet here, rating the questions from very poor to very good. The questions are here. Once you go through the 4 questions, it will flip over to the next screen, ask you 3 more questions, and you're done. Okay? Do you mind taking the survey today?
No.
Okay, so what I'll have you do, just be careful when you touch it. You gotta touch it with your fingertip so that it actually selects. If you hit it with your nail, it won't work.
Okay.
Okay? And I'll give you your paperwork. It was very nice to meet you.
Likewise.
Good luck with everything.
Thank you.
Again, if your doctor does not get the results by tomorrow, have them give us a call.
Okay.
Take care. Very nice meeting you.
Thank you.